Hazlitt, Okemos Meridian Township, Home TV.
Another edition of Open Line. I am your host, Destin Kaufman, coming at you from Home TV studios in Okemos. The World Health Organization estimates that between 65 and 80% of the world's population, that's over 4 billion people, use alternative medicine as their general practice for medicine. Now, that leaves between 10 and 30% that use what we would call conventional or traditional medicine. With numbers like that, it is no surprise that we are going to discuss alternative medicine this evening. Joining me, I have two guests. First, I have Annie Haas. She is the acupuncture therapist and Chinese medicine over at the Creative Wellness Center here in Okemos. Thank you for being here. Okay. And next to her is Dr. Daniel Dale. He is the chiropractor at Delta Chiropractic, and he's a chiropractor over there. So thank you very much for being here. Above and beyond my introduction, if you want to jump in and maybe just tell us a little bit about yourselves first and how you got into what you're doing, and then we'll go from there. Go ahead, Annie.
All right. So I'm originally from East Lansing, and I went to Indiana University for my undergraduate degree in anthropology. From there, I moved to San Diego, California, where I studied acupuncture and traditional Chinese medicine at the Pacific College of Oriental Medicine. It's a 4-year Master's of Science degree.
Okay. Very cool.
So,
Doctor, how'd you get into this?
You know, kind of the back door. It picked me more than I picked it. I was going to school already. I was a massage therapist, working my way through school. I was a personal trainer. I started working for chiropractors, and I had lots of injuries. I used to kickbox, and so I had a lot of injuries from that. And you know, I just became a believer. And then the chiropractors that I worked for, they encouraged me, no, you need to switch majors. You need to be a chiropractor. So, like I said, it picked me.
So then what, that's a 4-year and then another 4 years?
Yeah, I went to school 10 years altogether.
Oh, okay.
All right.
All right. I guess I'll start with you, because I remember when I was growing up when chiropractic became a form of medicine, because we had never even heard about it. And I remember my mother saying, "Oh, well, that's just quack medicine. It's new.
Exactly.
Nobody knows what's going on." But I think today that she's changed her opinion of that as it has evolved. What was it exactly about the chiropractic? I mean, what year was this when you started going into?
I graduated in 2007. So I went in 2004. Yeah, I went later in life.
So very recently then. Okay,
yes,
very cool. Yes. What alternative medicine covers a lot of different things. In other words, there's chiropractic, there's herbs, there's the medicines, there's the acupuncture. Why do you suppose, and I guess I'll ask you specifically, why do you suppose that in this country those forms of treating specific illnesses are not quite as respected as they are around the world?
I don't know that there's a lack of respect. I think it's maybe more of a lack of understanding or familiarity with it. Okay. I found, living in San Diego out for 6 years, acupuncture and traditional Chinese medicine, chiropractic, alternative medical care in general is much more mainstream than it is here in Michigan.
Right.
So I think it's, I don't think that there's a lack of respect. I think it's more of a lack of understanding and education about what's out there.
Right.
So.
I mean, you hear stories of people. Well, my uncle couldn't get the treatment that we had heard about, let's say in Europe, so he decided to fly over there for the specific treatments. And so in my research, I started to wonder how much of that is controlled by the giant pharmaceutical companies not wanting their products to not be taken all of the time. Is that something that you find that you fight, or not necessarily fight, but that's a challenge for you to try and sell what you do versus what the pharmaceutical companies tell us is right?
Personally, I don't think it's a huge issue, because I think a lot of my patients and the people that come to me tend to be a little bit more fed up with the traditional medicine route. Again, comparing my experience in California to here in Michigan, out there, acupuncturists and traditional oriental medicine doctors are primary care physicians. So a lot of people will go to their acupuncturist as a first line of defense for an illness or ailment that arises. Here, the people that I see are typically a last resort. So they've tried everything else. They've had surgeries, multiple pharmaceutical prescriptions, and they're just not seeing the results they want. So as a last ditch effort, they'll try acupuncture. And most of the time, they're very happy with the results.
Gotcha. Doctor, do you find that the majority of your clients or patients are trying to heal something, or is it more of a preventatory type?
Originally, people come to us for pain, more often than not. But chiropractic is a lifestyle. You know, it's a healthy lifestyle. We focus on 5 areas of the person. Right. Chiropractic, the nervous system. Chiropractic is based on the nervous system. The nervous system controls every cell in the body. Right. The nervous system is the brain, the spinal cord. No chiropractor would be complete.
Right. No, I'm so glad.
It's dry spine.
Yeah. No, this is really good. I like that.
The brain, the spinal cord, which runs down through this hole right here, and then you have 31 holes on each side of these that come out nerve bundles, and those go to organs and every cell in the body. That's how the body communicates to and from. So the nervous system is the master controller. So like I said, chiropractic is a lifestyle. We try to teach people how to lead a healthier lifestyle, starting with the nervous system. We also focus on rest, stress management, exercise, and nutrition.
Now, if I walked into a chiropractor's office and I'm not feeling any particular pain, are there ways that just by feeling my back and looking at my back, you can tell whether there's something in process?
Most definitely. Thousands and thousands of hours of palpation. Right. You know, in school. So that's what we do. Chiropractors' hands on the body are kind of like reading Braille. You know, that's how we're taught to read a person's body with our hands.
Gotcha.
So
that's really, really cool. Are either one of you familiar with some of the herbal remedies that the culture, I mean, in the Chinese medicine, I'm assuming.
Absolutely. Yeah.
Now, are you familiar, this is the one I've been hearing a lot lately, carnivora. Are you familiar with that one, the fly trap thing? I've been hearing on the radio, some herb from China or something. Okay. All right, well, we won't, I looked it up a little bit and they were saying that it had all these, you know, healing properties. What are some of the biggest, let's say I have high blood pressure. What would be a Chinese remedy for a high blood pressure situation? Does it depend on the person?
Yes, absolutely. That's kind of a loaded question because, and that's kind of where acupuncture and traditional Chinese medicine differs from Western medicine, is that each treatment and treatment plan for the patient is very individualized based on the patient's presentation. So, you know, an herbal therapy that might work for you might be not the most appropriate formula for him, depending on what your other presenting signs and symptoms may be, your history, medical history, what herbs or supplements you're taking, any prescription medications you're already taking.
So you just the same as walking into a doctor's office, you're going to take, it's an intake. You're going to find out everything that they do.
Absolutely.
And so, and by the way, the Creative Wellness Center, I hear advertised on the radio all the time as well. So that's very cool.
Great place.
So when you go in there, do you just as a doctor's office, you have, you know, like a medicine cabinet that are all natural herbs and stuff, or because there really aren't pharmacies, are there?
Actually, there are.
Okay.
I practice herbal medicine. I'm board certified in Chinese internal medicine and herbal medicine, so I do practice internal medicine probably with about 50% of my patients.
Okay.
I use a pre-made herbal formula that's in a pressed pill form. So there are different administrations of Chinese herbs. The most common, or probably the best, is a raw herb tincture or decoction. We call it a tong in Chinese medicine. And what I would do, you know, if I had a raw herb pharmacy, which would be absolutely amazing, is I would, you know, determine what was going on. I'd prescribe a formula for you, put it together, send you home with a little package of all these different raw herbs and medicinals. You'd put it in water, boil it for 45 minutes, strain it, put more water in, cook it down again, strain it, and then drink that tong or decoction from it. As you can imagine, compliance is extremely low with that form, especially here in the States. You know, my experience even in California, where it's much more mainstream, people might do it for a few days, just kind of for the novelty of it, but they don't want to take the time and it doesn't taste great. So I found that pressed pill form, even though it's a little less potent, I'm going to get higher patient compliance, which is at the end of the day what I'm looking for. So yeah.
Do you find that the herbs are hard to get here? In other words, do you get them from China actually, or they're around here as well?
Yeah.
Okay.
Well, I don't know of any herbal pharmacies here, although the Asian supermarket right on Grand River does have a lot of Chinese herbs, and they have some Chinese herbal remedies. I actually use a formula from a company based out of Albuquerque, New Mexico, called Golden Flower Chinese Herbs.
Okay.
So
very cool.
Yeah.
Wheatgrass comes to mind because I remember we all had an LA Southern California connection, and I don't know if you're familiar with Jamba Juice, which is a very fresh squeezed place, right? So you can get your little shot of wheatgrass for $2.85 or whatever it is. And I remember taking it like once a week. I would go in and get a wheatgrass shot, and I didn't mind it. I thought it was actually pretty good. But I have not found a lot of places around here. And do you think, again, that's just a lack of the people's desire, or just because they don't really understand, because what I understood was like a wheatgrass shot has the protein of 2 steaks and 5 chickens, and it just was this whole list of everything that you were getting out of this wheatgrass shot. So it just seems crazy to me that they're not on every corner offering wheatgrass shots.
Yeah.
Go ahead, please.
No, you're right. California is definitely more health conscious. I missed that about being here.
Right.
But we're just not educated yet. It's part of people have some apathy, but the more educated they become, and the more, like she said, fed up they become with traditional medicine and the way of living, they'll come around.
Right.
I have high hopes. So.
In both of your experience, and I'll ask you both the same question, does the mind control the body, or does the body control the mind?
Good question. Like I said, as a chiropractor, I'm sworn that
right, you gotta uphold.
The nervous system controls everything. The nervous system was the first system developed in the body, and that's for a reason, because it's the master computer. You can think of it as a conductor of a symphony. The nervous system is the conductor of the symphony, all the cells in the body. So I say the mind does control the body. Yes, definitely.
Okay.
And I would say that they have an equal, mutually supportive relationship. I think that you can't really treat one without treating the other, and I think that an illness in one aspect of the body can lead to an illness in the other, and vice versa.
A marriage, if you will.
If you will. Yes, I will.
Holistic medicine, does that differ from alternative medicine?
I think you can put them under the same umbrella.
Okay.
I think holistic just means all-encompassing, so you look at the body as a whole.
Okay. Let's dig into a little bit of acupuncture specifically. Acupuncture is obviously the act of putting needles in very precise places to achieve a very common, or a goal of some kind. What are some of the reasons people come to see you for acupuncture, and what regions do you associate with solving that problem?
You mean regions of the body?
Regions
like
of the body.
areas that I would needle, for example?
So if somebody wanted to quit smoking, where and why would you place that needle?
Okay, so that's a really easy question. For smoking cessation, I do something called the NADA protocol. It stands for the National Acupuncture Detoxification Association. And it's a 5-point auricular protocol, so it's 5 points just in the ear that are thought to help kind of reset the brain and the body to help fight addiction and the signs and symptoms that accompany giving up addiction, like irritability, anxiety, stress reduction. And it's a 5-point protocol. It's a point that corresponds to your lung, your kidney, your sympathetic or autonomic nervous system, the liver, which both in Eastern and Western medicine has to do with detoxifying the body, and a point called Shenmen, which translates as peaceful mind. So it's a point for stress and irritability.
Okay. Do people come, or have you give them acupuncture just to feel like normal out their normal lives?
Yes, absolutely.
Like going to the gym type of thing?
Yes. So Traditionally, acupuncture and Chinese medicine has been around for literally thousands of years.
Yeah.
And unlike Western medicine, that's a little bit more of a reactionary type medicine, where a lot of times we wait until the body is doing something wrong before we address it.
Right.
Whereas Chinese medicine and I think other alternative therapies look more at maintaining health and wellness instead of waiting for something to go wrong to treat it. So an analogy that I really like from a book that I read way back when, comparing the Eastern medical paradigm and the biomedical or Western medical paradigm, compares the way that they look at the body. And in a Western paradigm, the body is looked at kind of like a machine with all these different working parts that kind of work independent, and you wait until a part is not functioning properly or breaks down, and then you go in and either remove it or go in and fix it or replace the broken part. Whereas with alternative medicine or holistic therapies, we look at the body kind of like a garden, and it's something that you tend to kind of keep this balance within the ecosystem to maintain health and wellness. And when there's an imbalance in that system, that is when disease arises.
Right. Well, that seems like a much better way to go.
Yeah, absolutely.
In chiropractic, they call that vitalistic versus mechanistic.
Mechanistic.
So yeah, that's mechanistic is Western medicine. Vitalistic is what she just described.
Right.
Just another name for it.
Mm-hmm.
When I was kind of going through some research, I found a figure that was shocking to me, and that was that 2/3 of those who were asked about alternative medicine chose to not tell their primary doctor, their physician about it.
Yes.
Why do you think that would be?
That's a really good question. I run into that all of the time with my patients. When I first moved to Michigan, there actually wasn't even a law regulating acupuncture, and this was only 4 years ago, which is a little scary. Now we have a registration, so you at least have to be nationally certified to be able to practice legally in the state. And so when I first moved back, you had to have a written referral from an MD or DO to legally receive acupuncture. Now that's no longer necessary, but I think, just first coming back here, there were some MDs and DOs that, my patients would want to come see me and their doctor would say, oh, no, you can't do that. And I don't know if it was just an ignorance or, I don't really understand why they wouldn't want their patient trying an alternative therapy, especially something that's very essentially non-invasive.
Right.
But I don't know. And I have patients now that just don't tell their doctor for whatever reason, and I don't really know why. Do you have?
I mean, what do you think about that?
We get referrals from MDs. We
Okay.
have a pretty good reputation. It's a local surgeon that refers patients to us, but more and more MDs are referring to us. So that's a good thing. But on the other side, we get that as well.
Yeah.
Some MDs,
it's
don't really understand what we do. They've heard rumors, they think they understand, and they really don't. So.
Well, I've noticed certainly that alternative medicine seemed to be trending a lot more as far as, if you go on any of the sites. I mean, there's just so much more available information-wise on what is out there. It wasn't like that before the internet, I can tell you for sure, because I didn't know a whole lot about it, and again, in California, I learned a lot more about it, but here it was, when I moved back 5-6 years ago, it was non-existent. There was nothing like that anywhere. When someone comes to you specifically and they have, let's say, a sports injury, are you at that point working with prescribing painkillers, or is all you do specifically hand on body?
We don't prescribe at all.
Okay.
Well, sometimes we do a lot of rehab as well. Once we get the patient feeling better, we give them some specific exercises called maneuvers that help them hold their adjustments longer. Usually misalignments have many factors.
Okay.
One of them being posture. In our society, posture is terrible.
Yeah.
The average person, if you look wherever you go shopping, this is their posture. Their head juts out over their body. Their shoulders are rounded. These muscles are too tight. The muscles between your shoulder blades, your rhomboids, are too weak. So we try to correct that. Something called Tex Neck. Channel 6 just did an interview.
Tex Neck.
Yeah, did an interview with me about 6 months ago. Have you heard of Tex Neck? And if you look around, it's pandemic, not epidemics, pandemic. Wherever you go, the mall.
You're right.
Everybody's, their heads like this. So we give them some things that help correct that. We also we're the only chiropractors in Lansing to have what's called a Pro Adjuster. The Pro Adjuster is a computerized system that analyzes, looking for misalignments of the spine or vertebrae that are not moving properly. It was developed by NASA spacecraft, and then a chiropractor adapted it. And then it gently taps the vertebra back into place without twisting and crunching.
Interesting.
But I do work with athletes. Most athletes I do manual adjustments with. But that's another alternative. A lot of patients are scared, very scared of manual adjustments. If that was the only option they had, they would never get adjusted. So once they find out there is an alternative, they love it. It has like a 94% satisfaction rate. So
wow,
it's very unique.
I would like to remind the viewers that this is a call-in show, so if you would like to be a part of the program, be it a question or a comment for the panel, we encourage you to do so. The number is 517-349-1232, and you can also get us at our Twitter feed, which is @HomeTV, and I believe that it's at the bottom of your screen. Do you feel like when you do these adjustments, it's like the cracking of a knuckle where it's painful? Because my wife cracks things in her body, just makes these cracks, and it's like, I'm like, oh God, and she's like, well, it makes me feel better. I don't like cracking my knuckles because it hurts. So, you know.
What happens when you see young males,
yeah,
it's very dangerous. It's not advised to do that. But the person likes it because your body releases what's called endorphins and kephalons, and you get a peaceful feeling. It's a natural morphine.
Okay.
And so they get hooked on it. But what they're doing, they're not moving the vertebra that needs to be moved. If a vertebra is not moving properly, the ones above and below will compensate and they'll move too much. So when you do that, you're moving a hypermobile vertebra.
Gotcha.
So, and it's just making the problem worse. You create ligament laxity. So,
how would you respond to someone that would argue that a chiropractor sets you on a course where you need them because they...
Oh, it's a very common question.
Yeah.
I explain it like this. It's like going to the gym. I tried going to the gym, I went 3 times and they wanted me to keep coming back, or I took vitamins for almost a week.
Right.
You do it because it's a part of a healthy lifestyle.
Right.
You keep your nervous system tuned up because it's a part of a healthy lifestyle. People don't have to do it. I tell them, it's your body. You can go to the dentist when you get an abscess only, and
right.
he'll still treat the abscess, but that's probably not the best way to treat your teeth.
Right.
Your spine is very similar.
Gotcha.
I'll treat you if you just come in for pain, no problem. That's your spine, it's your body. But that's not the optimal way to treat your spine.
Gotcha.
It's easier to keep things moving properly than to try to fix them once you have a problem. So,
okay.
Does that answer your question?
Yeah, it does actually, because with the cracking of the knuckles, you hear, well, then you've got to keep cracking them to keep that up. So then, of course,
Exactly,
the naysayers are going to say, well, they're just cracking you so that you still have to go back and get cracked again.
And that's not true. That's
gotcha.
Not true.
Now, how do you feel about what I think is a myth, that the cracking of knuckles or adjustments will give you arthritis later in life?
I know I told my kids that because I'm like you. I hated hearing that sound.
Yeah.
But no, I don't buy into that.
Yeah. Well,
Joints are designed to move as long as you move them in the range of motion that they're supposed to be moved, not in opposite directions. So.
Okay. Very cool. Well, a little bit later in the show, we're going to get actual acupuncture needles out, and I have volunteered to allow this professional over here to put a needle into my ear wherever she chooses to have me experience the effects of acupuncture. So probably what we're going to do is take a quick break here, and when we come back, get ready to watch me get punctured. All right, we'll see you in a little bit.
Get connected to your township. Visit meridian.mi.us. On the Meridian website, click the Get Connected tab. Check out My Meridian, where you can create or respond to posts about Meridian, like this one. Look Meridian up on Facebook and click like for updates. Follow Meridian on Twitter. Get connected. It's easier than ever.
What drives Meridian Magazine?
It's our top-notch reporters and the stories they cover.
2 on the cable communications.
$108 million.
It's the crew behind the scenes making sure everything is set. It's our anchors that shine when the action starts.
Now residents can test out their ice fishing skills.
Home TV's Caitlin Coates is here with the details.
Meridian Magazine, your source for community news. Watch on Mondays live at 5:30 p.m. on Home TV.
Welcome to the show, Jules and Charles.
Welcome back. We're just actually deciding how we're going to get this set up. I've decided I'm going to do my hand. I'm going to get that done. And yeah, if you wanted to come, or maybe I can meet you in the middle.
Sure.
Because this is our camera here, or how about that? Is that going to work?
That works,
Okay,
yeah,
perfect.
sure.
So what exactly would you normally put an acupuncture into a hand for?
Well, there are a number of points on the hand, so depending on what I'm treating, I would obviously needle accordingly.
Okay.
The point I'm going to do on your hand today is probably one of the more famous acupuncture points.
Okay.
It's a point on the large intestine meridian called
Okay.
large intestine 4 creatively, or the traditional name of the point is Haegu, translates as bone valley. A lot of the traditional acupuncture points are named after either an anatomical location, so this actually happens to be halfway through the metacarpal bone, hence
Okay.
the bone valley. So this is a point that controls digestion. It's what we call a command point for the head and face. So I often use this point for anything from headaches to sinusitis, rhinitis, allergies. This is a point I use for pain when needled with, how's that, okay?
Yeah.
Okay,
That
so
wasn't,
there it is.
That wasn't bad at all.
So this is a point that treats pain, low back pain, needled with 3 other points on the body. We mirror the points on the left and right side, so doing the same point on the right or your left hand and 2 points on the top of the feet on the liver meridian. This is a point combination we call the 4 gates, and it's thought to circulate qi or energy through the body and treat pain anywhere in the body.
Like I can feel a tingling in the back of my arm. Is that normal?
So this is your large intestine meridian. Goes through the elbow, up the shoulder, up here, goes up through the side of the neck, and actually crosses over and ends at the opposite side of the body on the nose. And it's actually the only meridian that crosses from one side of the body to the other.
That's really
All the other
weird.
vertical meridians just go up and down on either the left or right.
So then if you were applying this treatment, would you want to apply it to both hands if you were doing it normally, so you get both sides?
No, not necessarily. So again, depending on what I'm treating, sometimes I'll needle the same point bilaterally. Oftentimes I will do different points left to right, depending on what I'm treating. I typically try to use fewer needles in a session, so
And those are what?
fewer needles.
Oh, fewer needles.
Yes,
I got you. Okay.
Yeah, so I'll typically use anywhere from 4 to 12 needles per patient,
Okay.
depending again on what I'm treating. Sometimes I'll just use a few needles, sometimes I'll use more. Again, depending on what I'm treating, how many different things I'm treating in one session.
Is there a specific length of time that you leave these in when they've done their job, they've achieved what they're supposed to?
Yes. So again, it kind of depends on what you're treating. I was taught that it takes the chi or the energy of the body 21 minutes to circulate through all the channels and collaterals. So in my mind, as long as the needles are in for 21 minutes, that I would consider a full treatment.
Okay.
I typically leave my patients for 30 to 45 minutes. I don't think everybody quiets their mind and kind of relaxes into the treatment as soon as I leave the treatment room.
Right.
So I like to give them a 10 to 15 minute wind down window before I start that 21-minute timer.
Right.
That said, if I'm treating someone that has can I take it out?
Yeah, absolutely.
If I'm treating someone that has a migraine headache, I might leave them on the table for an hour and a half or until their headache goes from like a 9 out of 10 to a 1 or a 0.
Now, when you, sorry that we're specifically focusing on this round because I'm fascinated.
This is fascinating.
So is there an exact point on my hand or is it kind of a region? In other words, because everybody's hands are different.
Are different, exactly. So it's more of a region. It's usually the tip of the patient's finger. And it's really interesting the way that we find point locations on the body is everything is done in a Soon or Chun measurement.
Okay.
And a Chun is different on each body. So it's like the measurement will be the same. So for example, from your elbow crease to your shoulder is 9 Chun or 9 units. But your 9 units are going to be maybe longer than his 9 units because you're a taller person. So, so we divide, we know what these units are. So we know it's 12 from the wrist to the elbow. So, if I'm looking for a point that's 2 units up from the wrist, I would, divide it in half, divide that in thirds, and then find the point. And so your point wouldn't necessarily be the same, like, centimeter, inch measurement as it would be on his.
Right. Gotcha. Now, because when it went in, I felt like it might have been, subcutaneous, but yet there's no blood. So you're not going that far down into the skin, right?
Again, it depends on what I'm treating.
Different one.
Yeah,
Okay,
yeah.
levels.
So typically I insert the needle fairly superficially. So it's usually, I'd say an 1/8 of an inch to a 1/4 of an inch deep.
Wow.
That said, I typically use 1-inch long needles. I do have longer needles that I'll use on different areas of the body. For example, if I'm treating someone with sciatica or piriformis syndrome and I'm needling into the glute, I might use a 2 or a 3-inch needle to get through the fatty tissue to get to the muscle underneath.
Okay. And last question. I guess we have a caller really, really quick. Jan from East Lansing, can you hear me? Hello, Jan, can you hear us? We might have lost Jan. Well, if you call back, Jan, we'll get you on the show for sure. Now, are there different size needles as far as the width of the needle?
Absolutely.
Okay.
Yeah.
And that is to achieve a faster goal?
No.
Or not necessarily?
I think of the gauge or the width of the needle as patient comfort. So I tend to use a finer gauge needle just because it's less invasive.
Right.
It depends really on the style of practice of the acupuncturist. So, for example, when I was in school, the needles that we used were a little bit thicker gauge than the needles that I use in my practice.
Okay.
Again, probably the number one question that I get as an acupuncturist is, does it hurt?
Right.
And, again, pain is subjective, so the answer is, it's different for everyone. Most people don't even feel the insertion, or if they do, it's, a tiny little prick or a little tap on the surface of the skin. Most people, especially here, their only experience with a needle is a hypodermic needle, which is much, much thicker and hollow. So it's going to be a lot more painful going into the skin.
Right. Because obviously you could put a nail into somebody and that's going to hurt a lot,
yes.
But that probably goes the other direction. So in following that line then, as people got more comfortable with acupuncture, you would recommend that they increase the gauge?
No, not necessarily.
No. Okay.
Yeah, I think, the only other benefit from having a thicker gauge is you have more control over the needle for insertion purposes. So, for example, the gauge that I use, the needle is so fine and thin. I can show you another one. It actually, if I tried to insert it without this is what we call a guide tube. It's just a clear plastic tube. It helps with the insertion of the needle. Here's the needle itself. So it's really fine and thin.
Oh, wow.
Yeah, so if I tried to just insert that into the body, it might just bend like that on the surface of the skin.
Right, so the tube helps keep it a little more straight so that you can actually
so I can get more of an
in
impact to get it through the tissue.
Interesting. That almost looks like a hair. It just
it's
wobbles
very fine
around.
And thin. Yeah, it's about as thick as a thread.
Interesting. Back to chiropractic because, I have friends with issues with their back. Oh, we do? We have got Jan back. Okay. Jan from East Lansing, can you hear us?
Yes, I can.
Okay, very good. Thanks for the call. What's your question?
I recently underwent chemotherapy and radiation for non-Hodgkin's lymphoma to the neck and throat area, and as a result suffered nausea from the chemotherapy, dry mouth syndrome from the radiation, and anxiety. And I'm wondering what your two guests could have done to help alleviate that.
Okay, well, thank you very much for the call, and that's an excellent question. I guess we'll start with the chiropractic side.
We were just talking about this. Chiropractic and acupuncture, we don't treat symptoms. We just remove the interference from the nervous system, which allows the body to heal itself and to treat the symptoms.
Okay, so in this specific example of chemotherapy, chemicals that are just eating your body alive, you're working with the nervous system to teach the body how to get rid of them.
To remove the interference and allow the body to heal. The body is designed to heal. That's how we're designed. It's designed to heal. If you cut a corpse, nothing happens. You cut a body, eventually if you keep it clean, you remove interference, nervous interference, the body will heal. So that's our job as chiropractors. We allow the body to heal. The body is the healer. We call it innate intelligence. Acupuncture, they call it chi or ki. It allows the body to heal. The body has an innate intelligence that's designed to heal.
So from the standpoint of chemotherapy, if Jan came to see you, what would be the process? Would it be more adjusting, or would it be more just working with her lifestyle to?
Both of the above, yes. I would definitely adjust the spine with the Pro Adjuster, definitely the instrument I described earlier, very gentle, very precise. And I would encourage healthier lifestyle choices.
That would work with that.
That go along. Like I said, chiropractic is a lifestyle.
Right.
A healthy chiropractic lifestyle.
Right. And you, I mean, how would you approach that situation? Would you recommend more of the Chinese medicine side of things, or acupuncture, or both?
I would probably do both, and I would also recommend probably diet and lifestyle therapy, depending on what her diet and lifestyle were. Right. And I would want to prescribe Chinese herbal medicine, but it would depend on what other medication she was currently taking, and I'd have to make sure there was no potential herb-drug interaction. Right,
and I know I'm putting you on the spot because you don't know her specific, diagnosis or anything.
Yeah.
I mean, but obviously, she should search out other avenues as well with what she's doing. I mean, I think we've made that pretty clear.
Yeah.
Thank you very much for the call. I guess
along those same lines.
Yeah, please.
Cancer Treatment Centers of America. I'm sure you've seen the infomercials.
Absolutely, yeah, sure.
They have chiropractors on board as part of the team.
Yeah.
So.
Okay. Now, are there insurances that cover these sorts of things? In other words, if I called my insurance company and I said, I want to have some acupuncture done because I think it's going to help my high blood pressure, are they going to go, oh, sure, well, we cover that on page 64? Or they're going to be like, are you out of your mind?
Depends on what state you're in.
Okay.
And it depends on what insurance company you go through and what your plan is. So for example, Blue Cross Blue Shield, I have some patients that have Blue Cross Blue Shield, and the acupuncture is actually covered here in the state of Michigan. They have a copay for it. Partly depends on their plan or their coverage, and it depends on what the diagnosis is. So for example, if it's a medical necessity, for example, knee pain or arthritis, generalized anxiety disorder, that would be something that would be covered. If it was infertility, which is something else that I treat, that's not considered a medical necessity, so that's typically out of pocket.
Gotcha. Okay. And I'll get back to you because I have another question. But we do have Kristen on the phone, and I think she said from East Lansing. Can you hear me, Kristen? Hello?
Hi, can hear you.
Perfect. Well, thank you for the call. What's your question or comment?
Doctors, can you do acupuncture with addictions?
That is a very good question. Thank you, Kristen. And I would imagine addictions are probably a big one.
Yes. So definitely smoking cessation, that NADA protocol that I spoke of earlier. We do that for just about every type of addiction, be it sweet cravings, alcohol, you name it. We just change the protocol ever so slightly depending on the addiction, and also I would typically do body points if I wasn't doing smoking cessation. So for most of the other addictions, I do body points as well as the auricular acupuncture.
Okay, and are all the addictions different, or do you just classify smoking and other addictions as two categories?
No, I mean, I consider them all addictions.
Okay.
But, you know, again, we have to look at the patient's history, at their background. You know, is there an emotional component? And again, it depends on the addiction as well.
Right.
So, yeah.
Back to the insurance. That was a good question. Thank you for the call. Are you finding that now insurance companies are more and more willing to work with chiropractic offices?
Yeah, we've had coverage for quite some time.
Okay.
As you know, co-pays,
Sure.
with the changing of insurance, co-pays are higher, deductibles are higher for everybody around the board. But yeah, most insurance companies cover chiropractic. You have to call your insurance company and find out what your coverage is, what your copay is, how many visits per year you get. But most insurances cover chiropractic.
Gotcha. Let's get into a little bit about meditation, because meditation is probably the single alternative medicine that people could do all by themselves and really don't have to go see somebody, I guess technically. What's your experience of meditation? How would you describe, first of all, what it is and what is the importance of meditation?
I'll let you say it.
So meditation for me is just a quieting of the mind, you know, or rather a quieting and a clearing of the mind, and a time that you can kind of focus on your body and what your body's feeling, how you're feeling emotionally, mentally, physically. And it's a time to practice deep breathing and just generally relax and de-stress.
Is there a specific time that you would recommend? I mean, or is it different for everybody? However long it takes to shut down?
You know, I don't usually like to put too many rules on it.
Of course, yeah.
You know, I find a lot of my patients have problems meditating in terms of being able to turn their mind off, and then they just get more frustrated because they're trying to meditate and they can't, and it just turns into this downward spiral.
Right.
So I try to encourage them to just, you know, if a thought comes in, don't get upset with yourself, just address the thought or acknowledge it and let it pass, and try to focus on, you know, something more simple and
because I mean, I have to admit, in comment, you know, whenever I meditate, it's just like, am I there? Am I doing it right? I never know if I've really actually meditated or if I haven't. So that's why I was asking, like, is there a specific way you know that you did it successfully?
Well, for me, I actually feel embarrassed to admit this, but I'm not very good at meditating because I have a hard time quieting my mind. So the most successful meditation that I've ever experienced is during Tai Chi, which is, it's actually a form of martial art, but it's basically like a mindful movement.
Right.
And for me, it's a slow, kind of relaxing, it's called the Tai Chi flow. And it's just enough movement that you have to pay attention to what your body's doing so your mind can't wander. So for me, that works really well.
Right. So you can still relax, but your mind is doing something at the same time.
Exactly.
And how do you define it? And what
for
is
me,
it for you?
exercise is my meditation.
Okay.
You know, that's we're a Christian clinic too, so we, you know, meditate on the Word.
Right. Right.
You know?
Okay.
So that's between exercise and meditating on the Word.
Right. Now, is this is it more cardiovascular for you, or more
I
like
do both. I lift and
you
I
like
do cardiovascular.
like all of it?
Both. Yeah.
Okay. Yeah, because I mean, I feel like when people are starting to step into the alternative, and maybe not necessarily for a problem, but just to kind of more of the upkeep, as we were talking about, changing the oil in the car rather than waiting until the engine blows up. They maybe don't know that they're doing it right, or they're just like, well, this isn't doing anything for me, or how do I know? And guilty, you know, I was just like, oh, you know, I put some quiet music on, and all I could do was think about what I had to do at work the next day, and what I haven't gotten done, and it just was like, I was like, I don't even know if this is doing anything. So
well, for people like you that, you know, are kind of like, oh, I don't know if I'm doing it right, I recommend an introductory class to, you know, like basic yoga, beginner's yoga, guided meditation. You know, we have classes like that at Creative Wellness, and a lot of people can take an introductory class and then kind of hit the ground running and do it on your own. You don't have to continue going to a class necessarily. A lot of people like that group atmosphere.
Right.
So I think that you kind of vibe off of other people's, relaxation.
Right. That's really good. I'm glad that you mentioned that because, it seems like yoga and meditation are very synonymous with each other. So, at the Creative Wellness, though, you have an area where teach classes in there and everything.
Absolutely, yeah. We have a classroom.
Beautiful.
We do yoga, NIA classes, guided meditation.
Okay.
We also do like weightlifting classes, dietary classes.
Very cool.
All kinds of good stuff.
More specifically for, since you said that you're faith-based, do you work with more of the faith healings? In other words, we've seen the commercial, when they get hit on the head and they fall and then they can walk,
I do, as led, I do pray for my patients. If they're comfortable with that, I definitely,
Yeah.
I definitely pray for them. I lay hands on them and pray for them, along with the adjustment. So.
Do you find that that's more common or less common?
More common. People embrace it. I haven't had anybody that, rejected it.
Yeah.
So, they thank you. They always thank me. Thank you.
Yeah. Well, that's really.
Like I said, I'm usually led. I feel comfortable in doing it. Sometimes I just do it. If I've done all I can do, it's time
you've done your job.
Yeah. So.
There are people that say that you could walk around a park every day for 15 minutes and that would be enough to heal you if you believed that would heal you. How much of, I guess, any medicine, be it alternative or traditional, do you feel that it's the person's belief in whether it's going to work?
I don't know. Oh, sorry.
No, go ahead.
Well, I was going to say, I don't know if it's so much like a belief, but I do think that there's definitely something to be said for a positive outlook.
Right.
And, having a healthy mind is a healthy body and a healthy spirit. And, I think, like in Chinese medicine, I think with chiropractic, it's the same way. You can't treat one without having an effect on the other. And so I think, I know that if I have a skeptic in my clinic and I treat them, if they don't believe that the acupuncture is going to work, doesn't mean it's not going to work. In fact, it typically will work.
That's cool.
It works on animals, and you can't placebo an animal.
Right.
So that's what kind of got me into the medicine in the first place. But I think that I don't think you can, necessarily miraculously believe your way out of a terminal illness. But I think there is definitely something to be said for having a healthy outlook.
Right.
Or
that must be
outlook.
cool. You almost like to have those people who come in and are like, this isn't going to work, and you're just like, okay, well, let's just give it a shot and see. Yeah. When both of you go home at night, what are some of the things that you personally do to your own body, just as a regimen, to cleanse or keep the oil clean, as it were?
Like I said, I try to go to the gym 4 or 5 times a week.
Okay.
Try to eat healthy.
Okay.
I don't do a perfect job of it. I try to drink plenty of fluids.
Right.
Water in particular.
Do you do teas or any kind?
I do drink tea. I drink green tea in the morning. I also drink Bragg's apple cider vinegar in the morning.
Okay.
It's a little shot of that. That's a good detoxifier. It increases your body's pH.
Okay,
So
and I've heard
that's
that
how I
recently.
start my day.
I was like, people just drink vinegar, just like vinegar.
Yeah, it's not the most pleasant. It's not as bad as you'd think, but it's not delicious.
Right.
It's not Kool-Aid.
Right. But you probably acquire a taste a little bit to it. Okay.
Some people, they dilute it with water. Mm-hmm. To me, that's just prolonging. I just rather get it over with.
Right. So. Okay. And how much was that, you said?
About a capful.
There's a capful of vinegar. Okay. Yeah. And how about you?
I try to just live a balanced life, and I try to eat healthy, very clean eating. I don't eat out very much. I like to prepare a lot of my own food. Mm-hmm. Definitely stay hydrated, and I like to do things that keep my mind and body happy.
Cool.
So.
Because I've been reading a lot about the teas, going through this, a lot about how you can put different herbs in teas just to keep your system running at a better level. Do you have belief in those?
Yeah, well, I'm a big believer in food as medicine, and I think, eating a whole food, healthy diet, you shouldn't need to take a lot of supplements. So You know, I think the reason we take supplements is because we have a deficiency typically. And if you're doing things correctly with your diet and lifestyle, if you have a deficiency, it should be something that's remedied fairly quickly with a supplement and not something that you're taking indefinitely. Again, everybody's different, and different supplements work for different people for different reasons. But you know, I think of diet, exercise, and sleep as free medicine. So.
Right. I guess the term supplement sums it up. You're supplementing something that you're not doing elsewhere.
Exactly.
I guess we're just got about 5 minutes left. In conclusion, what would you tell the viewers would be the best way for them to start themselves on a path of alternative living? In other words, not necessarily medicine, but taking that first step, because as you said, I think a lot of people, especially in Michigan, they're very afraid, or they just don't understand how it could benefit them. So what would you say to them to help encourage them to make that first step?
You know, I would say if there's anyone that's interested in acupuncture, traditional Chinese medicine, to call me at Creative Wellness. I do free consults either in person or over the phone, and I'm happy to answer questions about the medicine, about things that might be going on, different ailments, injuries, and talk to them about how I can help. And if I can't help, I try to find someone else that can.
Yeah. So I mean, just reach out and ask the first question.
Absolutely.
And you, I mean, what's a good?
We also do consultations, free consultations. There's also a book my business partner wrote. He'll like that I gave this.
Yeah, absolutely. Get a plug for him.
And we do a class every week. I was telling her, just teaching people how to lead a healthier lifestyle. And that class in book form is called The Reservoir of Health.
Okay.
My partner, Dr. Roos, wrote this. You can get it on Amazon.com.
Okay, very good.
But it just focuses on those areas that we focus on to lead a healthier lifestyle. Very good book, real easy read. There's some testimonies in there. So it's a good book.
And what exactly is the class? It's just
we just teach we encourage all our new patients to come to this class, and we just teach them. We focus on several areas: how to lead a healthier lifestyle, exercise, nutrition, rest, stress management, spiritual component, the nervous system, obviously as chiropractors.
Well,
so
that's important.
And we just give them goals in each one of those areas to work consistently, I should say, to lead a healthier lifestyle.
Awesome.
So putting it into action.
Yeah, well, and that's really the key, right? You can have all the knowledge in the world, but if you don't apply it, it's not really going to help you.
We always say baby steps goals done consistently make huge changes in your lifestyle.
Right. Well, that's really cool. I appreciate both of you being here. Very insightful. Annie Haas, she's the acupuncture therapist and Chinese medicine, dare I say, expert over at the Wellness Center here in Okemos. So if you have any questions, please give her a call. She's very available to answer those for you. And of course, Dr. Daniel Dale, he's a chiropractor over at Delta Chiropractic. Both of those, I'm sure, are very searchable if you'd like to get a hold of him and ask him a question as well. I'd like to thank everybody for joining us this evening. We'll see you next time.